We're now going to move on. From now, we have our next program section, which is the dialogue session, and we're going to head straight into it. So, everyone, we're thinking we'll take a break in about 1 hour's time, so please bear with us for another hour, everyone. So, the dialogue session, we're going to ask Inaniwa-san to be moderator again, but she's going to be joined by Professor Ito from the Tokyo University of the Arts. Ito-san, if you'd like to step up. Okay, thank you. We'll continue on with the dialogue session. So we're joined by Professor Ito from the Tokyo University of the Arts. Hello, everyone. Very pleased to meet you. My name is Ito. So Professor Ito, originally, as President Hibino was talking about co-creation, this new project that started from April of this year. And this is something that is based at the Tokyo University of the Arts, involving various universities, arts organizations, and corporations. So within that context, Ito-san, you're the project leader, I believe. So up to now, there's been a lot of topics that have been covered in presentations, talk about social prescriptions, for example. Your project, I think, has started with involvement on those aspects too. So what was your take on the presentations that we've had so far today? Maybe if you could just briefly introduce yourself and talk about that. Yes, thank you. So at the top of the dialogue session, I just wanted to do a quick introduction of myself before going into the main portion of today. So as Inaniwa-san just introduced, from April of this year, we have this co-creation society, art creation, co-creation base, which is at the Tokyo University of the Arts. So this is a project that we just started, and this is called a national project for the next 10 years. So today, here at this forum, we're talking about a base for co-creation, a forum for co-creation. It's not something that's done by a single university. For example, today at NCAR, including here, there are 39 corporations, research organizations, various local authorities and municipalities who are on board together to look at isolation, loneliness, and various other social challenges that we're facing. We want to be a base for overall and holistic solutions for these issues that we face. So we've just started getting going. So listening to everybody who's been talking today, I think partnership is something that has been highlighted as being extremely critical. I think that's been something that we've all picked up on today. So today at the National Center for Arts Research, you're co-hosting this event today. So we working together, the people that we'll be collaborating with, within our base, we have Keio University, for example, here, we have other organizations, DNP is here, we have corporations here too, we have a number of different participants today, and I think we need more and more connections. More and more of these partnerships, whether it's museum-focused or whether it's focused around an educational institution like us, a research institution like us, I think this is really important. And in fact, within the Tokyo University of the Arts, President Hibino is taking leadership on this in terms of the Arts Future Research Lab. This is university-wide to try and engage with these challenges. It's a big pillar that we're running with. And up to now, listening to all the conversations that have happened, it's not a 1 or 2 year span. It doesn't matter what the program is. For the duration, we're talking about 10 years or certainly a long span of time. You can see that a lot of experience has been accumulated over the years. So that's a lot of good learnings for us. So we've just started in April this year, so it's been 6 months or so for our program, but there's so much more for us to do. And we have to create a much broader engagement to be able to reach high. So this is a great opportunity, today's forum, for our project. Thank you very much. So we've just started together, and in this project, we're talking about social prescription. Social prescribing is something that's been talked about already. And this isn't just culture. It can be across multiple sectors like sports, or even within art, it could be literature. I think there is very broad social prescribing. So when we talk about this and specifically cultural prescribing, I guess we create that from here on in, and we work with a variety of local authorities to identify what is the cultural prescribing that suits that particular community and region. That's right, social prescribing, the word social, about society, that's a literal meaning, but when we talk about society, it's more about the warmth of other people. It's not just systems and institutions. There are more things which are living that are important, whether it's art, whether it's culture. Those are the kind of things that we're trying to proactively focus on right now so that we can help people to recover, so that we can create a society with high resilience. That's what we want to look at as a university, as a museum, and with various research bodies. So working with a variety of different people and institutions about that. So what is social prescribing? That's often asked. So today, when we've been speaking and hearing the presentations, the things that people are doing in each of their places, things that are effectively social prescribing, we're going to go into a dialogue session now, and up to now, we've heard presentations on inspiration talk, and it's been highly inspiring so far. So having gained that inspiration, when we look at co-creation, creating together, we want to spend about an hour or so talking about that collaborative aspect. So talking about art and culture and activities, what steps can we take to enhance health and well-being? If that's the question that faces us, there are positive aspects that we want to discover. There is the future that you want to achieve and realize. By looking at these things, you then lead to the next action, to the next activity. So we're going to be hearing from two more speakers today to think about this question. So if I can ask everyone to keep this question in the corner of your minds, the back of your minds, as we listen to our two next speakers, because we're going to be asking everybody in the forum to think about this later on. So with that, without further ado, I'm going to ask Jane and Fujioka-san to step up onto the stage, please.
So good afternoon, everybody. It's really wonderful to be here today. And after the really inspiring talks so far, I'm pleased to share a short, specific case study about collaborations in creative health at Dulwich Picture Gallery. So I'm Jane Findlay. I'm head of program and engagement at the gallery. And I've been leading the learning participation programs there for around 6 years. And in the last 2 years, I also took on exhibitions. So my team really looks after anything audience-facing where people and art are coming together. Okay. So I'm going to start with a little introduction to the gallery and a bit of context to how we work. So Dulwich Picture Gallery is the first gallery in the world that was built specifically to house a collection of art for people, the public, to come and see. We've existed for over 200 years and are a visual arts institution based in southeast London. And our collection of old masters and changing exhibitions has been and continues to be an inspiration for artists and visitors alike. At the gallery, we center audiences in the work we do and aim to enable people to make sense of their world through kind of meaningful encounters with art. Collaborating with audiences in Southwark, Lambeth and Lewisham, who are our local boroughs, we platform diverse voices, and we are evolve dynamically as well with the needs of those communities. Our work is divided into 3 strands: relevance and representation, thinking about whose stories we're telling and what matters to people today. Learning together, which is around skills and development that enables people to thrive in their own lives. And art and health and well-being, which I'm going to talk about today. And all of this is underpinned by an ongoing community-based action research project that is looking at how our collection can really speak to contemporary ideas and themes and things that matter for people today. So for over a decade, we have built kind of expertise in health and well-being programs at the gallery. And where in the past this was predominantly focused around older people, it's now a thread that runs throughout all our programs and all our audiences. And in essence, we're trying to be an active agent for positive change and thinking about how we can create healthier and happy communities by really embedding creativity in people's lives. And we work across the whole spectrum, from general well-being to targeted work in clinical settings. And all our work is delivered collaboratively, working with service users, health providers, and we have a number of long-term partnerships with the NHS, the National Health Service. So that gives you a little bit of a grounding in our approach. And today I'm going to talk about a 4-year multi-arts program for the Tessa Jowell Health Centre. So the Tessa Jowell Health Centre is a new NHS initiative. It's a new integrated healthcare hub. It serves around 250,000 people in South Southwark and is designed to integrate a range of health and wellbeing services all under one roof that speaks to the needs of that local population and helps to reduce health inequality for a very specific community. So it includes a general practice, pharmacies, local hospital services, health inclusion teams, and mental health services. And I will share a video to a link to a video, because we haven't got time at the moment, where you can hear from the staff talking about the centre in your own time. The centre is very locally rooted, and the communities that are kind of around it and will use it have been part of the centre right from its approval to the design, and now through to the activities that take place in the building. It opened in May 2020, which feels a bit of a miracle in the middle of the COVID-19 pandemic. With our handy map, you can see where it is. It's based 20 minutes walk from the gallery, and we have been the health centre's cultural partner officially since January 2020, but conversations started a lot earlier. And it was really born out of this shared goal to both reduce health inequality and centre local needs in health. And we developed it in partnership with the estates team there that were creating the project, and the clinical teams and the service users board. So the project has 3 kind of key aims. One is enhancing the healing environment through co-produced artworks. Second, to deliver a cross-art form creative program to improve well-being for staff and service users. And thirdly, to embed the value of the creative arts in the local social prescribing model. And these 3 aims then translate into strands of activities, which I'll take you through now. There are 3 of these too. So the first is a series of co-produced commissions in the centre. And these have all been developed with different service user groups and local artists, and range from visual arts to sculpture, digital interaction and performance. Our most recent commission saw people with long-term complex health conditions exploring the theme of care through creativity and movement. And it was produced in partnership with dance company Siobhan Davies Studios, who are also local, over 6 workshops, showcased in the centre, and now the film of the participants' performance is installed in the doctor's waiting room, offering a calming and meditative focal point for people waiting to meet their doctor. Next is our Creative Mondays programme. This is a cross-arts creative offer. It takes place every Monday at the centre, and they are free workshops and courses, and they're designed to introduce service users to different art and creative activities that help them to feel active, mindful, relaxed, and importantly, provide opportunities to meet new people and make connections. They were developed with the social prescribing link worker team based at the centre, so really thinking about what kind of things people were presenting to them, what kind of issues that their service users were facing, and how could we work with them to support that. So they support people who might have anxiety and depression or other mental health conditions, people living with long-term health conditions, and also people with caring responsibilities and chronic conditions. So it covers a range of different things. And the program is intentionally created and delivered, with a consortium of local arts partners. And this is really about first sharing and expertise and bringing a kind of very rich cross-arts offer to the centre, but also about springboarding people and helping people to understand the offer that's available for them in their local area. So people also get a pass to visit the gallery, they can access our programs, and we've noticed that they've been going together and seeing different things at the different arts partners that we've been working with, which is wonderful. So our offer included music and mindful movement with City of London Symphonia, singing for stress relief with Breathe Arts Health Research, and deep listening with the organisation In as well. People can be referred from a GP, a doctor, a link worker, or any other health provider, and we also take self-referrals too. And our evaluation is showing improvements across measures, including indicating that the programme is really kind of positively changing participants' personal and social well-being. And the highest increases we've noticed are in people feeling happier, feeling more active, and being more interested. But we've also seen changes in self-esteem and supportive relationships. And Dharma, one of our participants, has said for her, it was a fresh start. She felt that she was just thinking negatively over and over again, but this gave her a fresh start, a fresh opportunity, and she's taken part in subsequent lots of different programs with us and has come back and is now visiting other places in the local borough. So that's the kind of positive journey that we've seen through this program. And the final... Oh, I'm going back, sorry. And the final program is around training for staff and health and well-being for staff as well. We developed this with Performing Medicine, who are real experts in art-based training for health professionals. And the sessions are really designed to support social workers both to understand the ways in creativity can support health and well-being for their service users, but also themselves. They are delivered by artists, and they have many parallels to our Monday sessions, so they have these real inbuilt health benefits. And they've recognized through doing them and experiencing them actually how it's impacted on them, and then that helps build confidence for them to make referrals and the wider offer in the area. And now the Link Worker team have kind of got this new perspective. We're building on a more substantial program from our training conversations we've had together, and this kind of increased appetite in their desire to look at the whole range of creativities to support well-being. So we are a four-year project. We're 2 years in. So I'm just going to talk about some brief kind of things that have resonated with me, just 3 kind of areas. So the first is defining value. And we've talked about a very strong evidence base for the impact of arts on well-being. But it's on the ground, I felt there's quite a varied understanding of what that means. Even in the health centre, we have a link worker she's got a background in creative art. She really understands it. We've got a doctor who understands the social value of the centre, but maybe doesn't understand health as much. And then we've got an estates team who are more engaged in kind of putting art on the walls. So a whole range of people understanding different ways that art and health can intersect. And so for us, what it was really about was having lots of conversations. So we spent over 6 months talking to the team, working together to kind of define this shared vision, shared value for the programme, and to really think about what that meant for the individuals, to the staff, to the community in the centre. And it's led to a much broader and richer programme of activity. And this is also now reflected in our evaluation, which is done by Dr. Faye Sawyer at the Birmingham University, and shapes how we talk about the programme and its impact. So when you're starting to have these conversations, I think building that timing can be really helpful. And it took, to find that kind of vocabulary that you both kind of understand. And once you have this, also, you've got something to work from, and you can kind of come back and reflect on it. And I think we've both been on a journey. This is a new centre, it's a new project for us, and as we've built trust and gained understanding, we've definitely kind of changed the way we value, I think, as well. Next, care, this term that keeps coming up. So for us, this project has been really helpful in us asking us to actually think, what does care mean? What does good wellbeing look like for this specific project, for all the different people involved, service users, artists, project managers. My microphone's not working. Sorry, thank you. Sorry. So thinking about for all the different people involved, service users, artists, staff, building managers, project managers, so many different people. We couldn't have a blanket approach to well-being. We really had to stop and think about what people need and to ask if we didn't know. And we've also been very inspired by Performing Medicine's Circle of Care in developing this work as well. And this is a framework that puts as much focus on the health professional or artist providing care as the individual receiving care. And it kind of makes that fundamental to achieving effective healthcare, which is significant even with our very overstretched NHS. And so this is where our training program, the supervision for artists, and this growing well-being offer really comes in. And they're not things we've thought about afterwards. They're something that are fundamental to our program and something that we have also seen a growing importance as we've continued. And I think CARE is also thinking about creating work that's steeped in local need. Our work is really based on this appreciation that the reality of many people living in that local area is difficult, and there's lots of tough choices that we're having to make that impact our quality of lives. And it's really important to think that person-centered work is informed by that lived experience, and it's not just someone's medical diagnosis, but all the different things that intersect in their lives. So that kind of idea of health as intersectional has been really important in the project too. And I think working with empathy and care has centered people in what we're trying to do. And then finally, this is a slow burn process. It takes time, it requires patience and perseverance and celebrating just tiny things as well as bigger progress. Originally, we had a bit more of an ambitious time frame with multiple strands kind of happening together. But the pandemic actually really stopped us it stopped us from doing the work in this way and led to a much more staggered way of working, which actually I think for us has been for the better, and that we found with building up from small pilots to creating scale whilst holding this kind of big overall vision that we had, an idea of value, has been positive in developing the work. And we've had this clear vision, but a framework that we've enabled us to really kind of be informed by the centre. The centre's only been open, so we've only been working it since it's been open, so we've had to react to opportunities and respond to things that aren't working, and that's kind of been a good way of kind of creating meaningful work. For example, the co-commission projects we started are more in-depth. They were working with different service users groups. They were a great way of getting to know people's needs, and then we can use that to inform the Creative Mondays program. And it also helped develop our relationship with staff as well and build their understanding of the program for referral. So it's kind of had a positive mind. So although it felt painfully slow sometimes, tiny steps, it's actually led to a longer-term engagement and a more sustainable way of working. That's also translated into funding as well, and we've now got 3 years funding to continue the work. So I'll finish here. As I said, we have still got 2 more years of the project. And I think these are things, though, that have stood out for me, and we are learning all the time with this project. Even though it's a very hyper-local kind of project, the ideas and the approaches are also kind of informing our more general work around broader health and well-being. And I hope that this was also useful for you too, whether you're setting out on this journey or you're already delivering this work. And I'm really looking forward today to our discussion session where we can learn from you and chatting more with you. So thank you for your time.
ありがとうございます。
Thank you very much.
ジェーンさん、今、
So,
コロ
Jane,
ナ禍で少し
you talked about COVID and how that slowed your pace down, and originally you had some much bigger ambitions possibly, but
多分ロンドンの
I
中で
think
も
even within London, the Dulwich Picture Gallery
プリスクライビングの
has
活動
been
なんかもすごく
active in social prescribing, really at the forefront of that, I think. And every time I hear what you have to share with us, you're always engaged in something new. That's a really strong impression that I have of you. So this morning, we were talking about the mental health program, the
の中に一つダリッチピクチャーギャラリー
brochure with the 16 examples. And I know that one of the examples that was taken up in the report was the Dulwich Picture Gallery. So that's great. So I think with that, we'll move on to Fujioka-san, and then we'll talk a little bit with the both of you. Fujioka-san, if you'd like to do your presentation, please. Hello, everyone. My name is Hayato Fujioka. I'm a curator at the Tokyo Metropolitan Art Museum. Today, I'm going to be talking about an example from Japan. From 2021 at Tokyo Metropolitan Art Museum, we've been involved in creative aging Zuttobi, and that's what I'm presenting on today. Very briefly, let me introduce myself to you. 15 years ago, I was actually studying at a UK art university. In the art university, there wasn't a lot of cultural programming for older people. That's my sense of my university. But today, listening to all these different presentations and talks, I feel like in the last 10 years, our engagement culturally with the aging population has vastly spread and increased and progressed. Listening to all of the examples that have been shared today, it's great to be able to re-encounter the UK for me. So I personally, a few years ago, began working at the art museum. So as far as the sector goes, I'm still very much new to it and learning. But back when I was a child, my grandmother was diagnosed with Alzheimer's. I remember my grandmother's condition changing very drastically. With dementia, she was treated not very well by those around her. Her friends kind of didn't stick by her, and she became socially isolated. 20 years after that, my grandmother was indebted to a facility that she lived in. So she had a very stable life, but things that she'd loved, sewing, cooking, being active in the community, she couldn't continue with any of that because she became living with dementia. People around her took extra care, like, this is too dangerous, you shouldn't do that. It restricted my grandmother's activities, and I remember a sense of frustration I had even though I was a child. And I think that's possibly something that's feeding into what I'm doing now in my work. So on the left, the picture that you see, this is Tokyo Metropolitan Art Museum, and on the right is the logo for this project, the Creative Aging Zuttobi. So we want to be an open doorway for art for everyone. That's our mission at the Tokyo Metropolitan Art Museum. But amongst the older population, perhaps it's hard to get around, perhaps there's dementia that makes it harder to go out, and museums and art galleries tend to become a more remote presence. So what we've done is we chose the name Zuttobi for our project. So Tokyo Metropolitan Art Museum has a nickname, Tobi. So we added the word zutto, meaning always, to Tobi. So it doesn't matter how old you get, you will always feel that Tobi, the art museum, is close to you. And not just the Tokyo Metropolitan Art Museum, but that art in general is still very close to you, something that really matters to you. You have a society that doesn't pressure your access to these kind of facilities. You still have free access to them. Generally speaking, aging is referred to in language like declining. You can't do this anymore. It tends to be quite negative. But creatively advancing in years, creative aging, if we can convert the meaning into something positive, that's what we, in our Zuttobi project, place a great deal of emphasis on. So it's a little conceptual, but we as humans are constantly changing. So the future is always an unknown. It's always overwhelming with possibilities because it's unknown, and I think that's true of art as well. For example, if there is an unexpected new discovery, if you think about that as you look at a piece of art, or an artist as they are creating something, they try to create something new that they hadn't thought of. That's what they're trying to do in their process. Art is about encountering something that you haven't met before. It's a discovery. So as well as involving and engaging with art, you're engaging with uncertainty, engaging with unknown things. You're gaining age. You want to accept people as they go through the creative aging process. That's my spin on it. So let's take a look a creative aging. What is it that the Tokyo Metropolitan Art Museum is doing to engage with this? So as part of the Zutobi project, looking at a piece of artwork with someone is the main focus of our activities. So for example, here, you're in an installation space. People are closely looking at an artwork. You can observe things clearly. You remember things from the past. You might try to imagine how the artist felt when they created the piece of work. And next to you, there's somebody that's looking at the same piece of art. Somebody that you can share the things you've discovered and you felt about that piece of art. There is that sense of empathy that you can have with others. So at Zutobi, for elderly people with dementia and their families, we set this up, the Van Gogh exhibition at home. You can see a picture on the left. This is back in 2021. Across the whole of Japan, we had participants, we used Zoom to connect, and we broke up into separate groups to view Van Gogh exhibits. So for example, at this Van Gogh exhibition at home, you didn't get a curator giving a commentary. This was about the participants, and this is a picture of a breakout room. Participants would look at the artwork, and they would just freely talk about what came to mind or what they remembered when they saw the artwork. So participants being able to spend time paying attention and express what they felt, they needed to feel psychologically safe, and also they needed a willing and reassuring ear that would listen to what they were saying. So in this program, who's carrying a big role? Here you can see art communicators, Tobira, from various communities working based in the Tokyo Metropolitan Art Museum. Tobira is our informal name for them. They're based in museums and galleries. They're about connecting people and people, connecting people to artworks and people to places. The age of the Tobira are from 18 through to their 70s. They might be company employees, freelancers, teachers, students. Lots of diverse people. They have the ability to bring diverse perspectives to museums, and they are active in what they bring. So in Zutobi, Tobira is always there to create a place. They listen to what participants are saying so that the participants can actively view the artworks. So the Tobira project, normally, as well as the place of practice, we create a place of learning as well. This is one example, an accessibility course. So this was from a nurse at a general hospital, and they were telling us about accessibility for dementia. Sorry, my slides are going back and forth, but going back to the Van Gogh exhibition at home, for example, this is Vincent van Gogh's orchard bordered by cypresses. The art communicators, Tobiras, would ask, "Do you notice anything about this piece of art?" And there was a participant who said, "If you look at the middle of the picture, next to the roadside, there's still little leaves. So it's probably spring, they're still growing." So the one person thought this was a spring-like scene. Somebody else said, "I used to have a beautiful plum grove at my house, but now I can't take care of it anymore. I kind of miss it. I'm kind of nostalgic about it." So they remembered something from their past. So in each group, there was somebody who was living with dementia, somebody who was a family member. There was a Tobira in there as well, the art communicators, so that everybody feels something different, says something different about what they see. And it's about respecting what each person has to say and has to feel about these artworks. Rather than being the caregiver and the care receiver, it's about a level playing field, a flat relationship. This was really important to the attendees. When we did the survey after the program, that's something that the participants told us. So in order to spread this, what Tokyo Metropolitan Art Museum did is that we spoke with the Council of Social Welfare in Taito Ward in Tokyo. And we were able to connect together in this way at a meeting. We did the Van Gogh at Home exhibition and we shared about that. We asked people to take a look around the Tokyo Metropolitan Art Museum, and we exchanged a lot of opinions. We spoke with social welfare specialists, and we heard that the Van Gogh at Home exhibition was really positive. It was helpful in increasing quality of life for these people who are living with dementia. Also, in Taito Ward, we worked together with medical facilities to come up with a community-operated dementia cafe. So we were able to observe a number of these dementia cafes that were being held, and through our community link conferences, through these opportunities for dialogue, we created a good relationship with the Council of Social Welfare and with people in medical care. The outcome of that is that we worked together with the Eisu General Hospital Medical Center for Dementia Diseases and the Taito Matsugaya Comprehensive Support Center to hold the Orange Cafe. So this is Taito Ward's dementia, people living with dementia and their families, 17 people, joined in to look at an exhibition together with the Tobira that featured Danish furniture and chairs, looking at nostalgic furniture pieces from the message team, from the communicator team. There were message cards. The medical and welfare team made lots of preparations to make sure that there was successful participation. This is how the program worked out. Together with the art communicators, Tomiras, the participants were able to take a look at the chairs, the shapes, the colors, and they were each able to verbalize what they felt when they saw this. The medical and welfare team were pushing wheelchairs, for example. They were helping people out from a care side of things. But the art communicators, the Tobiras, were not carers. So during the program, the Tobiras were focused on communicating with the participants. After seeing the exhibition, there was a recap session, and the Tobiras, from start to finish, were there on a level playing field with the participants, looking at the artwork, being on the same level as the participants, communicating at that flat level. Let's take another look at another picture. This is something that we worked on together with the Taito Ward Hospital and the Minowa Asakusa Comprehensive Support Center for the exhibition Okamoto Taro. We had two groups with families with dementia members as well, looking at two paintings by Taro Okamoto to talk about what they remembered about Taro Okamoto. Okamoto Taro was a designer for a theme pavilion for the 1970 Osaka World Expo. Looking at this brought back memories about Ueno after the Second World War, the factory where someone used to work. So there were all these different conversations happening. So these are the kind of programs that we've been covering through Creative Aging Zutobi. Starting with our citizen Tobiras, we'll continue to work with medical and welfare specialists so that we create a society where people feel that museums are close to them and for them. Thank you.
Thank you very much, Fujioka-san. So the Tobira project and art communicators, I believe there are around 130 people in the team, ranging from people in their teens to their 70s. And I understand that they are working on a variety of activities. I understand that this is not something that suddenly happened. In 2017, when Tokyo Metropolitan Museum was going through a renewal, you started off this project. So this is the 11th year of starting this project. And you have gone through a round of trial and error practice and revision, looking at the issues that you see in the background and also sharing initiatives. And I believe this is a program where the museum has taken initiative to make that happen. So, yes, from here, we would like to move into dialogue explanation. However, we will be going into a break shortly, but I do want to explain what we're going to do about the dialogue. So our two guest speakers have just had their presentations, and you've heard the activities that both Jane and Fujioka-san have been working on respectively. Jane at Dulwich Picture Gallery and Fujioka-san at Tokyo Metropolitan Art Museum, you've really drawn on your strength. You've had your own motivations for the project. And you've pieced these together to form these successful programs. And we've also heard in the inspiration talks earlier how there were various reasons for the programs to go ahead. You've accumulated all of those experiences to build on. So when we're thinking of next steps for the program, I'd like to focus a bit more on what are the discoveries that you had over the course of your work. So when you do your work, what discoveries did you have? Like in hindsight, what things could you have done more creatively? Or what did you feel was a key point in making the work happen? So what discoveries did you have as you worked on your project? So can I ask you first, Jane, what were the discoveries that you had over the course of your work? Anything that you felt were strengths that helped? And what was the motivation that really helped to drive the program? So if you have such points, please share.
Sure. So I think for us, the taking and really understanding what our kind of local area needed and what the gallery could do, and having those conversations locally and taking the project from that, and really with the kind of community-based action research we've been doing, really deeply trying to understand what the gallery can mean for that community today. So I think that's one kind of key point for me, and that changes. So that's a constant conversation you're having with local partners, local people, and each project you're learning new things and you have that sharing. So kind of keep continually building and evolving that as well. So I think that's one thing, and that kind of really aligned with the Tessa Jiao project, because both the health centre and us were trying to do the same thing, and we had an alignment there, which was a kind of opener for this kind of work to happen together. So I think that's kind of, and that's kind of the motivation in that. That's what we're here to do. That's what the gallery is here to do. It's part of our strands of work is about this. It's happier, healthier kind of lives through creativity. So that kind of drives us and keeps going, keeps wanting to do this work, because it takes time to develop things. But that's and then I think on the kind of terms of discovery of things, I think partnership and long-term commitment is something that we've talked about, everyone has talked about throughout the day, and that kind of having that long-term commitment is crucial to this work, and to be willing to take that journey and that long step kind of approach to things has been really significant. And I also think that encounter and connection is something that we've all talked about as well. So finding those meaningful points with people, having those conversations, not being afraid to ask people or to make connections and reach out to people, and sometimes they can happen, they can come to you, but being receptive to those, or sometimes it's about you reaching out and having a conversation with someone else. But we've really found that key to ours as well, and trying to foster that kind of space for conversations and encounters, and it can come from something small or a bigger thing. So even today you may find someone to talk to, and that might create a project or an idea together. So I think being open to always to that.
So, Jane, you've been working long in the picture gallery world and working with the welfare people, the healthcare center. I'm sure there was a time when that was a completely new challenge for you. Before that point, you would not have had much interaction with the healthcare world. So when you got started getting into healthcare, that would have been a very new area for you. So how did you make that jump? How did that leap happen?
I think a lot of it was about us learning and listening. So really trying to understand kind of the healthcare world, the words that they use and how the words we use, how we could speak to each other, doing a lot of research, talking to our community. That also kind of helped us to make that start, and thinking about learning from other experiences and practice that had been happening, and really kind of taking that and thinking about what can we do to apply that in our local context, and then being brave, because this is all new for us as well at a point, but being brave, trying and not being afraid of doing something small, very, very small, and just seeing how that went as well, and building from that, and kind of having that kind of iterative learning process kind of as part of what we were doing with health and well-being. So, and that continues. We're always continue learning and listening, and that's kind of part of the work. But I think, yeah, starting small is by little things. We had a little starting conversation with a mental health recovery college, and that was the starting point for us. And it was just one coffee I had with one of the team leaders there, and from that we've grown our program. So it can be very tiny, that interaction you have.
Thank you.
Thank you. So starting from something small, starting there and then growing it big, I think that's really important. Because sometimes, you know, at first it feels like you're trying and you're not delivering, or there's no results. But it's not a question of the result. You have to find the growth for yourself. You can't just sit back and wait for it. You have to look for the growth to be sure of it. I think that if you engage with something even a little bit, then what is it that you've delivered right now? You kind of have to evaluate yourself and find that and verbalize that, make it visual. I think that's really important. Thank you very much. So next, I'd like to ask Fujioka-san a question. So we have on here number 2, the thinking about the future that you want to achieve and be, dream. We've had a lot of discussion already today. So looking ahead, what is that future that you want to create? What is the society that we want to head toward? If there's anything you're specifically thinking about, then let us know. Thank you. So it's a difficult question in terms of what I want to achieve. When we hear about all these examples from the UK, and you have so many people, whether they're volunteers or people in the community, people involved in the medical or social welfare fields, that so many people are involved, and you've continued an effort for 10 years. Continuing an effort is in and of itself a big effort. So my project Zutobi, we're just in our 3rd year. We're finally starting to find our way with this. So continuing, sustaining the effort, I think is really important. That's something that today I felt really is an important point, because when you continue with the effort, where do you get to? What do you find at that point? Is that every time you do something, every time you add something, you start finding more possibilities for communication through art. You start to see that more clearly. It's not just me. Other people who work at the museum feel that way. Other people who work in medical, social fields, people in Taito ward. People start to see the possibilities. They start to have hope and expectation for those possibilities. As you start to spread those out, in Japan, unlike the UK, where there's a lot more advanced examples, we don't have a lot of that in Japan. I'm hopeful that this will spread out across Japan. That's my dream, I guess. Thank you very much. So for the 2 of you, the discovery and dream, we've asked those questions of the 2 of you. That leads us into our break and then our session after the break. Now, this is for both those in the venue as well as those who are online. So let's think about both of those different groups. But thank you first of all to our 2 speakers. Thank you.
Jane-san, Fujioka-san, ありがとうございました。
Jane-san, Fujioka-san, thank you so much.
And now we'd like to continue on with the dialogue session. So Inaniwa-san, Ito-san, can you continue, please? Yes, thank you. Now from here, we will be talking about the dialogue session. So what steps can we take to enhance health and well-being through arts and cultural activities? So this is the question. And we want to discover the excellent and positive aspects and envision what you would like to be, your ideal state. Discovery and dream will be the topic that we will explore. For example, I think in the audience there's people working at museums or at universities or people who are individual artists or artist-related people. And listening to the discussions that we had from the morning, you might have had ideas of new perspectives. You might have heard a new idea, creative ideas, or some possibilities that you haven't thought before. And so you can use the discussion as a source of new thoughts, but also starting from there, with the inspirations that you have received, you can go on and advance on to your own creative ideas, like any new possibilities that you've thought of. So I think there's two types of discoveries from what was talked about, and also developing your own ideas starting from there. And also, it's good that you have group discussions rather than just thinking yourself alone. So that's why we wanted to hold this dialogue session or group discussion session. And I'm sure that there is a cardboard box table right in the place that you're sitting on, and this was specially developed. So it's a desk that you can write on. It's a table that you will be able to write on. And there's a paper on the cardboard box table and also some notes, post-its. The same color paper as the table color. You have some papers on the table, and then there's post-its. So you can use both of that. So the two questions that we've posed here, first on the discovery side, I will be explaining in more detail from here. But for this discovery question, the answer I want you to write on the big circular table. And then for the second dream part, I want you to use that big post-it so that you can post it on each other and have it overlapped, lay it upon each other. People who's participating online, we have a special online format that's being delivered to you right now. And there's two questions we just shared here, written on that format. And then if you can write on that format, and the keyword is the Milo site, it can be posted on that Milo site. So we'll be seeing more and more ideas posting onto the site. So online members, if you can post your ideas onto this site. So we will be divided from here in two groups. So as we have the group discussion session, we're not going to do the live streaming. We'll have 20 minutes each to think about the discovery and dream time. So including the two of those question discussion time, and then plus some summarization time. After about an hour, we'll be back online with live streaming. So in the meantime, if those are participating online, please post your ideas on this Milo site. And also, we will be receiving questions through online as well. So is that okay? Is that instruction understandable? So from here, we'll divide in two groups, online and these on-site groups. So the online group, we'll see you again.
ここから5分間一人の時間の振り返りどうぞ。では皆さんですね、机に書かれた内容の共有をする時間を始めていきたいと思います。
当事者の方もそうですけど、ケアする方を一緒に並列で今日お話しされてたのが結構印象的で、それはどんどん変わってくるので、どの世代に向けてどのレベルで発信したらいいのかっていうのを、水だったり知恵とかっていうのがリソースになりうるんだなというところがすごく新鮮な発見でした。
次のセッションはドリームです。ここからは登壇者の話を聞いて、あなたが、これまでにここら辺が大事です。あまり言葉にはしてみなかったけれども、実はこんなことが実現していたらいいなというふうに思う望み、それや10年後くらいまでに実現したいなというふうに思う未来を考えてみてください。で、これはですね、お手元にある付箋に書いてください。付箋を書いて、自分のテーブルの中で、みんなが大体 未来のイメージが形になってきたかなというふうに思ったら、テーブルの中で共有を始めてください。ではこのセッション20分間いきたいと思います。どうぞ。
そこの有機的な横のつながりみたいなのが溢れる社会になったら素敵だな。一人一人がもうなんか発信者になり得るあり方ってなんだろうなっていうことを。
And from here, we want to ask some tables. What kind of dreams and discoveries that you talked about? If you can make some presentations per group. The museum in town, if they can be an area where it will be a mixture of art and the medical practices. In our living zone, if we can have that section where there's a mixture of art and the medicine, and the art museums and museums can play a role for creating that space. Also, it needs to be a place that is comfortable for the staff working there too. So going forward, probably that will be another important value. In this room, I think there's a lot of people that works for museums and works in the art field. And first, the priority should be the well-being of these members here. Unless we all are in a well-being state, we won't be able to have a convincing talk about well-being to the others. Related communities, people who are not the curators of art museums, how can they develop and design a art exhibition together with a non-art perspective, and also to have a more rich, fulfilled program developed. So each of us will had our specific dreams, and each of us provided advice to each other. That's the kind of discussion we had. Thank you.
I'll talk about what we discussed in English. So we talked about the community needs which exist, and we talked about anybody can be a social prescriber. And in terms of methodology, we were thinking about not a short-term span like 3 years, that we should be looking at a long span like 10 years to be able to do research. That's one of the things that we were most impressed with the presentations today. And with regard to dreams, creating place, creating location, a place to coexist and symbiotically exist, a place where you can design something like that. Museums is a place for individuals and the outer world to connect. It's like an intersection. It'd be great to be able to create a place like that. That's what we're talking about for Dream. Thank you very much. Thank you. And listening to what the speakers were presenting earlier today, specifically about dream, I have already my image of that dream for me. I think, step by step while I've been here, I think, dreams have to be verbalized in order to take shape. So what I've thought about, I've spoken with Mami Karaoke-san, I've spoken with Professor Ito, with Inaniwa-san. So I've been talking with people trying to figure out what form that should take and talking about how to leverage with Fujita-san and Takai-san with regard to all these cultural assets that Japan has. How can we leverage it in a way that it's been leveraged in the UK? So thinking about regional, local authorities, about specific individual cities and so on. So it's a level where there's more agility. You're not tied to a prefecture or a whole nation. So if there are some good examples, I'd like to see like all the way down to village municipalities. It'd be great if those more nimble municipalities could get going. It's been really reassuring to hear about these engagements that could be done. And I'm sure it's about spending a little bit at a time, but there's 10 years of experience already that's been accumulated in the UK. So using that as a step for NCAR, we've started to put this together, Tokyo University of Arts, we've started that future art lab. So it'd be great to make great leaps and advances right now. So, let's get, the country changed. Let's change the world of art. So with Osaka-san, I was getting rather excited there in our conversation. Thank you very much for sharing your comments. So from this morning, we've been talking with everyone. We've been listening to presentations from all of the speakers. And I think having a bit of time for dialogue is something that's valuable. You don't just listen. Like President Hibino was saying, changing things into dreams, shifting things into dreams, it's really important to experience these things. Inanima-san, what did you think? Yes, listening to all of the stories and presentations from this morning, everything was so dense in terms of information. So I'm sure that was a lot for everyone to digest. But being able to drop that into your own minds individually here in the room, I think there is room there for further thinking, for continue that line of thought. Yeah, it's important to be able to continue a line of thought, and hopefully there's been an opportunity to do that in this dialogue talk session that we've just had. So let's close out the dialogue talk session. We're going to then take a break and we're going to come back for the reflection talk. We're going to get our panelists back. We're all going to come back together on stage and we're going to recap on what's happened today.